Okay, so to cup the lower back tightness, we're going to get into this tabletop position here because it's a great position to do some different movements from. There's not a lot of stress on the individual as compared to standing or even sitting. The cupping location is going to be, on all of us, we have these muscles that run up and down each spine, and we basically want to go just off the middle of the back, which is the spine, and come onto that muscle bulk. If you find the bottom of your rib cage, you go just below that. That's one good location. If you find basically the rim of the pelvis and come just above that, that is another good location for you. And again, with the cups, depending on whatever application or device you're using, you want to just induce enough force where that tissue lifts up into the cup, turns a nice pinkish color, and then from here, we can rest, okay? A nice passive variation here is Steve can sit back on his heels and go into more of a passive lower back flexion depending on your hip range of motion and some other factors here. All right, and you can hang out here in kind of a passive lower back flex. Then you can come back to the tabletop position and we can go through a cat camel move where now with the cups on, he's going to actively try to flex the back. And I like to think about, which is cool about this, is just try to get the cups to separate as much as you can, and then try to let the cups come as close together as you can. And if you just think about that, you're probably doing the movement we want. What's really cool here with Steve is these cups are actually sliding on his back as he's moving, so he's getting some movement of the actual cups with the movement. So that would help with forward bending. If we want to improve side bending, he can just stay right where he is and take his hips to one side, but try to keep his shoulders square. So he's going to move the lower body and try to side bend, elicit a little bit of a elongation or lengthening on one side. And then he can come over to the other side as well. Okay, and you can do cups on one side, cups on both sides, whatever's going to work for you. And then we're going to retest some of the movements from before.